Stem cell therapy. It can mean different things. If we are talking strictly about stem cells and not other reagents that people claim are stem cells like exosomes or PRP, basically stem cell therapy involves 3 different types of cells. And I'm going to tell you how they differ, what are the pros and cons. The oldest source of stem cell is bone marrow. Bone marrow contains significant amount of mesenchymal stem cells. However, for serious medical conditions, they may not be enough. But the first stem cells that were used therapeutically. So there's a huge amount of data that goes way back, people using bone marrow derived stem cells to treat different diseases. But if someone has a disease that requires greater number of stem cells, then they have to consider other sources. The most common other source of stem cells, autologous stem cell, is that people can get stem cells out of fat. And these days, there's abundance of fat in most people because of the sedentary lifestyle and also less physical activity. The fat-derived mesenchymal stem cells, they work pretty much the same way as bone marrow-derived stem cells or stem cell from any other source. However, compared to the number of stem cells present in bone, fat has much more stem cells. So your harvest is much higher. So in many diseases, people use adipose-derived stem cells rather than bone marrow-derived stem cells. And the advantage here is that when you are using bone marrow stem cells, you get a lot of other types of stem cells that have a therapeutic value. For example, I'm talking about pericytes. You have endothelial progenitor cells that can cause neoangiogenesis. So if an organ or tissue is not functioning properly because of the blood supply issues, so these would be great type of stem cells to use. However, both these sources are generally autologous, meaning that tissue is taken from a person, stem cells are isolated, and then stem cells are put back into the same person, although the location is at the place where you want a therapeutic response. So for example, people who have osteoarthritis, they get their fat or bone marrow stem cells, have them processed and then put at the knee joint, for example. Sometimes the number of cells that you get from both these sources is not enough. So for example, from bone marrow or fat, the best you would do is about 100,000 mesenchymal stem cells, and I'm just talking about mesenchymal stem cells, not there are other cells in it also. So the number is not enough for certain type of diseases, and it's a numbers game too. It's not just the numbers, it is also qualitative and quantitative. So but however, quantity does matter in this case. So if patient requires a greater number of stem cells, we have to consider other sources. One of the most common source of stem cells used therapeutically is umbilical cord. Umbilical cord is obtained from newborn children. So generally it is a cord from C-section. That is pretty much standard. You get cord from C-section and not natural delivery. And the patient has to qualify, the donor has to qualify certain criteria. They have been screened or checked for infectious diseases like HIV, HCV, HPV, etc. So the cells that are going to be produced are going to be safe for therapeutic purpose. The great advantage of this technique is you can administer millions of cells. You can get hundreds of millions of cells from umbilical cord and administer, number one. Number two, these cells have a much greater therapeutic potential than, say, for example, adipose-derived stem cells or stem cells taken from bone marrow. Reason, age. As people age, so do their cells. So an older individual, will have fewer number of mesenchymal stem cells in their bone marrow or fat, whatever tissue that you are taking. And also, since they have been around so much longer, say 30 years, 40 years, whatever the age of patient is, so their ability to regenerate will be relatively much limited as compared to umbilical cord derived mesenchymal stem cells. So this is the basic difference, pros and cons between these 3 types of cells that are used therapeutically.